Welcome to part 2 of New Perspectives on Qi and the Channels, a neurophysiological explanation of acupuncture. We're now mastering the mysteries. So, taking a look at the contents in this part, we're going to be looking at the modern perspective of Qi and the channels. So, focusing a lot on the neurophysiological explanation of acupuncture, how the nerves essentially help to explain a lot of the functions of the channels, a lot of the mechanisms of acupuncture, and the understanding of what qi is, specifically de qi in the practice of acupuncture, and the sensation that the patient feels when acupuncture is applied to their body. So we'll be looking at the nervous system, reflex arcs, an explanation of de qi and acupuncture analgesia, so how it is that we understand that acupuncture actually relieves pain in the body. Then we'll be looking at referral patterns, which are one of the interesting things to look at to help explain some of the more stranger, mysterious properties of what the channels do and what we experience in actual clinical application of the channels that seem to have, mysterious unknown origins as to what's going on in the channel, but can actually be explained by things like referral patterns and the nervous system all up. So here we go. So starting off with the modern perspective of the channels, a neurological explanation. If you feel so inclined, you can leave some comments down the bottom in this particular course section of your experience of the channels. If you've had anything interesting that's come up that you feel like could have no other explanation apart from the fact that there must be these channels of vital forces going through the body, or meridians of energy, or however, even if it's physiological, whatever, you can leave some comments there. It'd be great to get some dialogue going about everyone's experiences, because that's what it comes down to. That's what we're all here to learn about, our experience as practitioners applying acupuncture. So, getting into it, as acupuncture has gained exposure and popularity, science has attempted to find an anatomical explanation for the basis of the channels. While many theories have been proposed, for example, primo vessels, the Bonham ducts, electrode measurements of skin resistance tests, and thermal and radioactive tracer imaging, none have consistently held up except for one idea, which is the nervous system. Locations of acupuncture points and primary channels overlay peripheral nerves that contain mixed nerve bundles containing motor units and sensory fibers that project into regions of the central nervous system to elicit a systemic effect. Now, if you haven't come across this book, I highly recommend you get a copy of it. Neuropuncture, a clinical handbook of neuroscience acupuncture. You could literally read it in a few hours. It's pretty short and very concise, and it's packed full of a lot of information by Mr. Michael Corradino. He's pretty on point with everything he's talking about the neurophysiological basis of acupuncture. Certainly one of the inspirations for me when I came across this book. I had always had an inkling about this. I just from studying anatomy and physiology myself, it's what I believed, and it's nice to see that other practitioners are moving along in the same direction. So if you can get a copy of this book, please do. It's very enlightening about what's going on with neurotransmitters and the nervous system within the body. So in his book, he says, imaging studies of acupuncture points show that nerve ganglia, which are clusters of neurons in the peripheral nervous system, occur near or directly under the traditional acupuncture points. These ganglia are stimulated by the acupuncture needle, which sends signals to specific regions of the brain, as well as target specific segments and plexuses. So just a reminder about what a plexus is. On the left, we've got the brachial plexus, and on the right, in the lumbar spine here, we've got the lumbar plexus, which comes down to, we've got L1 down to L4, and then from L4 down to the sacrum, we have the sacral plexus, so primarily the sciatic nerve comes out from L4 down to S3, and then you've also got the coccygeal nerves down here. On the left-hand side, we've got the brachial plexus, coming from C5 down to T1, so down to the thoracic vertebrae. And from C5 down to T1, these are the nerves that innervate the upper, lower arm and the hand, of course. So These are the scalene muscles here. Another great book that I have used as a reference in this part of the course is Acupuncture Therapy for Neurological Diseases. So this is a compilation of research and trials and also experiments done to determine essentially the underlying mechanism of acupuncture and what they found with the influence of the nervous system over all of these mechanisms. So in this book, it says, during dissection of cadavers in 1958, a TCM expert confirmed the location of 21 major acupuncture points with common acupuncture needles, and the underlying anatomy was studied. Results showed that acupuncture points and channels have a close correlation to the distribution of peripheral nerves. We have comprehensive data suggesting that the structural bases of acupoints are closely related to the special distribution of the peripheral nerves around the vessel, muscle, tendon, and other structures, with the signals being transmitted to the brain for processing. Via dissection, 324 acupuncture points, along with the 12 primary channels, were examined. 323 of the 324, so that's 99.69%, of the acupuncture points were examined to have a close relationship with the nerves. 93.83% of the acupuncture points were found to be related to the superficial layer cutaneous nerves. 52.5% of the acupuncture points were related to the deep layer nerves. 45.99% related to both superficial and deep layer nerves. And the final one acupuncture point, which is 0.31%, which is Ren 2 or conception vessel 2, was found to have nerve distribution by observing it under a microscope. So essentially all of the 324 acupuncture points that they examined all had a close relationship with nerves in the body. So we can see from just these two books which I've used that there's already quite a lot of evidence stacking up just by dissecting, doing this modern application of a medicinal approach of cutting into the body with cadavers to actually see what the underlying structures are, and then finding that pretty much all of the acupuncture points that were discovered or created centuries and millennia ago actually all overlie a peripheral nerve, and that perhaps the reason why they were created and used and have an effective result or response is because they're actually stimulating a peripheral nerve. So the nervous system, bringing to life the actions of acupuncture. We're just going to have a quick revision about how nerves work and how they influence acupuncture and how acupuncture influences the nerves. So you would have remembered these from learning biology. We've got non-myelinated and myelinated nerve fibers. So non-myelinated nerve fibers, which are the top ones here, are responsible for continuous conduction. So these travel up to, between 0.5 to 10 meters per second. So that's 1.8 to 36 kilometers an hour. So that's pretty fast already. That's for continuous conduction. So that means that remember the ion channels along here, it means that the signal has to travel along every one of those ion channels to create what's called continuous conduction. So it's the slower of the two modes of conduction for nervous tissue. Then we've got saltatory conduction, which allows the signal to leap the myelin sheath at what's called the nodes of Ranvier, which are the spaces in between. And because of this, it essentially allows the nerve to conduct signals at much higher speed because it's skipping all of this length in on the way. So saltatory conduction can go up to 150 meters a second, which is about 540 kilometers an hour, which is half the speed of sound. Pretty impressive, considering that most humans aren't even 2 meters long. So we've got a pretty fast conduction system for our nerve signals. And how these signals interact with the central nervous system is they come through the dorsal root, the sensory nerve, in what's called the afferent or dorsal nerve root into the integrating center in the spinal cord here, and then it either interacts with generally interacts with an interneuron, which is a nerve cell in the spinal cord itself, an integrating center, which will then synapse with a motor nerve, which is the red one here, which will deliver a signal to an effector, which is in the form of a gland or a muscle. And the green nerve here is symbolizing autonomic nerve signals. So how does acupuncture cause systemic effects? If we're putting an acupuncture needle into a point somewhere in the body, how does it cause such an effect throughout the whole body? Is because that point on that channel connects with other channels, and you've got internal channels which then connect to other channels, and then the activation of qi and blood can then jump from one channel to another or contact with internal organs? Or is it because there's a nerve in that region which is then communicating with the central nervous system, which then sends a systemic signal out to the whole body? So Michael Corradino talks about a way that the systemic effects occur by using large intestine 4 as an example. So the point is called Hegu, which is the traditional Chinese name for it. And this point, for those who don't know, is located in the fleshy part between the thumb and the forefinger. So if you press in there, you'll get kind of a dull, heavy sensation. That's large intestine 4, fourth point on the large intestine channel. So this area is innervated by the superficial radial nerve, the cutaneous branch of the radial nerve, and the palmar digital branch of the median nerve at its deeper layer. These nerves originate from C5 to T1 in the brachial plexus, which is essentially all of the nerve root outlets of the brachial plexus. So if we have a look at this again, so we've got, what would that be? C1, 2, 3, 4, 5. So we've got 5, 6, 7, and then T1 here. So all of these nerves here are traveling down and eventually innervating large intestine 4 in the fleshy part between the thumb and forefinger. So that is the radial nerve and the median nerve as well. So since all other nerves in the brachial plexus originate from the same nerve root, this tells us that these nerve innervations will also be influenced. A delta fibers stimulated by large intestine 4 terminate in the hypothalamus that, when stimulated, release beta endorphins. Beta endorphins stimulate the periaqueductal gray, creating a strong systemic pain relieving effect. This is an image that you probably would have seen some rendition of in an anatomy textbook or anatomy and physiology textbook at some point along the way in your education. And it's a fitting description because we have, well, the sensory nerve, if we were to say the sensory nerve is around here, which is where colon 4 is, but we'll just pretend it's in that area. So we stimulate this point here, or the sensory receptor, which will be here, in the muscle. It sends a signal to the dorsal afferent nerve and dorsal horn, which sends a signal up to the brain and crosses over. And then I haven't highlighted exactly what Michael Corradino was talking about, but essentially the signal goes up to the brain, which then releases the beta endorphin and sends that systemically out to the whole body. Remembering again the comparisons we were looking at before, so the channels serve to transmit acupuncture stimulation from the point to diseased areas in the body. Stimulating an acupuncture point, the qi and blood of the whole channel may be regulated. So the whole channel may be regulated. So if we're talking about the large intestine channel, which goes from the tip of the index finger all the way up along the arm up to the shoulder, crosses over and ends on the other side of the nose, or on the nose on the other side of the body. If we then look at this image, and if we've got colon 4 here, or this, the start of the large intestine channel, it receives a signal through the sensory nerve cells up to the brain, and then it sends a signal back down the motor pathway to the same area. So it's almost like we're getting an actual neurophysiological explanation of a channel being activated by the sensation being received and then a signal being sent back out. Now, this is really interesting if we look at this article from this particular author who talks about these experiments that were done where they were able to determine exactly what's going on with how nerves play such a large role in the actual mechanisms of acupuncture. Injection of local anesthetic into acupuncture points inhibits acupuncture analgesia. Essentially, if the nerve isn't able to be stimulated, then pain cannot be relieved. Vascular occlusion of the arm does not affect acupuncture analgesia of the hand, nor does blocking the cutaneous sensory nerves of the forearm. It is when the deep nerves are blocked that the effects of acupuncture are altered. And needling the affected side of patients with unilateral hemiplegia or paraplegia does not reduce pain in the opposite side. That's really interesting if you think about it. It means that essentially if the nerves are not conducting a signal, then acupuncture doesn't work. So even when it was saying that vascular occlusion of the arm does not inhibit acupuncture, it kind of puts to rest the concept that the channels are only related to blood. So deep tissue stimulation, not cutaneous sensory nerves, attenuated pain response. That also gives us an indication that it depends on the depth of the needle as well. So putting superficial needling in just on the skin, according to this, does not have nearly as much effect or any effect compared to deeper needling when you start to get what is called the Dirchi response. Now we're going to look at reflex arcs as a way of describing the different mechanisms of acupuncture. To remind everyone again, a reflex arc is essentially when a signal is being sent to the central nervous system and then straight back out in the spinal cord without you making any conscious decision in the process. So it's believed to be a survival mechanism, a means of self-preservation, so the body does not, when it interacts with a noxious stimuli, the body will preserve itself without us having to make any decision for it. Let's just have a quick reminder of how that works. We've got the sensory receptor, which responds to stimuli in the environment by producing a receptor potential. The signal travels along, conducts impulses from the receptor to the integrating center along the sensory neuron. So this is through the dorsal root or the afferent nerve root. It then synapses with an interneuron in the spinal cord, and then the signal comes out through the ventral root or the efferent. So it travels along a motor neuron, which conducts impulses from the integrating center to the effector. The effector is any muscle or gland that responds to a motor nerve impulse. And of course, there are different types of reflex arcs. So the stretch reflex is the typical one where everybody knows you get reflex hammer and hit the knee, and the knee will have the knee jerk reaction, and that essentially says that yes, you've got good reflexes. So let's have a look at what's actually going on. A stretch reflex is a muscle contraction in response to excessive stretching. Muscle spindles monitor the length of a muscle. It's a monosynaptic and ipsilateral reflex arc. So it's only one synapse and it's on the same side. So let's have a look how that works. Now, what happens is the patella tendon here gets whacked with a reflex hammer, and then as a result, we have extension of the knee. So the foot will go out and the knee will extend. So what happens is the stretch stimulates the sensory receptor via the muscle spindle. So the muscle spindle is in the muscle of the extends muscle that we're focusing on here, and the muscle spindle essentially monitors the length of the muscle and the tendon. And by putting the tendon on stretch, either with the use of a reflex hammer, or we can actually press, if we're doing the bicep tendon or something like that, we press on it, then hit the tendon. And the excessive stretching, it's believed that this is the reason it's happening. The excessive stretching triggers the body to preserve the integrity of the muscle and the tendon by contracting and shortening it. After we hit the patella tendon with a tendon hammer, the stretch stimulates sensory receptors via the muscle spindle. So that's in the muscle here. The signal travels via sensory neurons to the dorsal afferent horn. So the signal is coming through the dorsal horn up here into the integration center in the spinal cord. It converges at the integration in the spinal cord. The sensory neuron activates the motor neuron and sends signals to the same muscle to contract and prevent further stretching. So the sensory neuron has received the signal through the dorsal horn. It then sends out a signal down the motor nerve to contract this same muscle. So the threat was that the tendon was stretching. So by contracting, we shorten the tendon and preserve the integrity of the muscle. At the same time, a simultaneous signal is sent to a motor neuron via an inhibitory interneuron to relax the antagonist. So another signal is coming out and causing the antagonist to relax. So basically, stretch here, it causes this muscle to contract and this muscle to relax. So the quads contract and the hamstrings relax. At the same time, another signal is sent up to the brain, so we are made aware of what's going on. Now, the reason why I'm talking about this stretch reflex is that it gives us an indication as to how acupuncture stimulation of the nervous system may work. So in here, the stimulus is the patellar tendon and the shortening of the tendon and then the contraction of the muscle. But this lays the foundation of how many different mechanisms may work. Remember, before we were talking about the activation of the entire channel. So this is a similar situation here. A stimulation of an area of the body sends a signal to the spinal cord, it then sends a signal back down to affect something in the same region that we're working on. So this gives an indication of how we can treat something locally. So if you've got pain in your forearm here, you put a needle in, it will send a signal to the brain and then send a signal back down to create some kind of response in this area. It can be the release of beta endorphins, that can be the release of dopamine or dynorphins or some kind of pain relieving neurotransmitter in the local area. The next one we have is the tendon reflex. So this is muscle relaxation in response to excessive contraction. So it's kind of opposite to the stretch reflex arc. So the Golgi tendon organs monitor contraction at the junction of muscle and tendon. This is a polysynaptic and ipsilateral reflex arc. So there are multiple synapses happening here. Now, a Golgi tendon organ essentially does something opposite to what a muscle spindle does. It measures when there is too much force on the muscle. So the muscle spindle measures when there is too much stretch. This measures when there's too much contraction, basically too much force on the muscle, and there's the potential that the muscle is going to contract too much and possibly damage surrounding structures in the body. Increased tension in the tendon stimulates a sensory neuron via the tendon organ. So we'll say that for this example, the quads are contracting excessively. So this causes a signal to travel via the sensory neuron to the dorsal afferent horn. So same place in the back here to the integration center. There it converges in the spinal cord. The sensory neuron activates an inhibitory interneuron, which sends signals to the muscle of the same tendon to relax and relieve excess tension on that tendon. So if there's too much tension, this is contracting excessively, there will be an inhibitory signal sent back to that same muscle and causing that muscle to relax. So it prevents any damage to the area. At the same time, a simultaneous signal is sent to a motor neuron via an excitatory interneuron to contract the antagonist. So, opposite to what we saw before in the stretch reflex, now there's an excitatory signal going via the motor neuron to contract the hamstrings. So this is relaxing and this is contracting. So it's pulling the leg inward. So it's flexing the knee. And once again, the simultaneous signal is sent to the brain to let the body know, let us know consciously what is going on. To apply this to a practical situation in life, this is like if you're lifting something up and it's seriously heavy and then you're putting too much strain on your biceps, and essentially the reflex arc will cause you to let go of the heavy load. So it will cause the biceps to relax and the triceps to contract, causing you to let go so you don't basically tear your bicep. Now, applying this to acupuncture, we now get the next step, which is where stimulating a point on one part of a limb will affect the opposite side of the limb, so the front and back. or a different area within the same kind of region of the limb. So this is, if you stimulate the bicep tendon with an acupuncture point here, it implies that it can send a signal to affect the tricep muscle for whatever reason. So now not only are we stimulating the channel itself, but we're now jumping channels, and the signals are able to be sent to different regions of the same limb. Next, we have the flexor withdrawal reflex. This is multiple muscle contraction in response to noxious stimuli. Stimulation of sensory receptors of pain-sensitive neurons, and it's a polysynaptic and ipsilateral reflex. So once again, multi synapses here, polysynaptic, and on the same side. So in this example, I always thought this was funny because they use a thumbtack in the textbooks, and we're talking about acupuncture needles here. So essentially the end result of this is that someone steps on a tack and then they automatically pull their foot out of the way. Same as if you put your hand on a hot plate. Any kind of noxious stimulus is going to cause your body to jerk back in to preserve the system. Now, what happens with this is where we've got responses and signals happening on multiple levels in the spinal cord, because this is happening in different areas of the same limb. So in this example, the toe is being stimulated, yet it's the muscles in the upper leg that are actually responding. So the sharp stimulus activates sensory receptor dendrites of pain-sensitive neurons, which are nociceptors. So the nociceptors in the toe here are getting stimulated. The signal travels via sensory neurons to afferent dorsal horn. So once again, similar thing. So we're going to say that the signal goes to this middle one here, travels via the back here into the integration center. The interneurons in several spinal cord segments are activated by the sensory neurons. So essentially the signal is going up and it's going down, or it can all be going up or all be going down. The interneurons then excite motor neurons at different spinal cord segments and conduct signals via the anterior efferent horn. So we've got the one sensory signal coming in and then multiple motor signals going out to all different levels, all different muscles. The flexor muscles activate to withdraw the leg and avoid the sharp stimulus. Now we're starting to get the response of acupuncture on multiple levels and in different regions of the body. So this starts to explain how you can needle an acupuncture point down on the foot, and it's starting to treat things all the way up the channel, all the way up further regions up the body. I mean, if this is happening in the leg, what's to say it doesn't happen at higher levels as well? So perhaps you can stimulate something stimulate a point in the foot, which may stimulate either the lumbar plexus or most likely the sacral plexus, and then that signal is then traveling all the way up to the brachial plexus, the cervical plexus, all the way up to the brain, because there's also a signal that goes directly up to the brain as well to let you know what's going on. So what's to say that isn't creating some kind of response where which then provides the understanding as how we can use acupuncture points on the feet to treat conditions in the head and the face. And the last one is the crossed extensor reflex. So this is a multiple muscle contraction in response to noxious stimuli, much like before. Stimulation of sensory receptors of pain-sensitive neurons, so the nociceptors are being stimulated. What's different here is it's a little more complex. It's a polysynaptic ipsilateral and contralateral reflex arc. So it starts off the same as before. We have a noxious stimulus, which is sending a signal to the spinal cord, which is then being received in the integrating center, sending out signals via motor neurons to the muscles above and below, maybe if the stimulus is higher up, to contract the agonist and to relax the antagonist, which is I didn't add in before. Remember, when one muscle is contracting, the other is relaxing or contracting less, we would say. While this is happening, if you're standing there and you step on a tack, remember you have two legs. If you pull your leg away, if you don't do something with the other leg, then you're probably going to fall over. So what happens is the signal gets sent across to the other side of the body and sends out inhibitory and also excitatory signals via motor neurons to the muscles of the other leg, causing it to extend so you don't fall over. Now, this once again provides another explanation for how acupuncture, the stimulation of an acupuncture point with an acupuncture needle, can actually communicate with the opposite side of the body. For those of you who do not use acupuncture a lot, or don't use the real traditional sense, there is a technique that we do with acupuncture in that, say if someone comes in with a really badly broken leg, for example, and you want to treat that leg, or there's an infection on it and you really want to treat it, but you can't put needles in the actual area that's affected. What we do is we put acupuncture needles in the other leg with the intention that that leg is the same leg. And lo and behold, by doing that, you can actually see results that the pain will relieve in the other leg. Now, is that because the channels are connecting to each other and communicating with each other? Well, yes, if the channels are nerves and this is the way it's happening. I find this stuff fascinating because it starts to take away a lot of this mystery, and sometimes this mystery can also be confusion for not understanding why acupuncture does the things that it does, and just relying on a mysterious explanation that, well, there are channels that run there, so therefore that's the explanation. Here it is. This is a basis for a potential explanation as to why this happens. Why you can apply acupuncture to one side of the body, and as long as there are active nerves, of course, someone doesn't have paralysis in that hand, you can actually get a response on the other side of the body. So you can get pain relief on the other side of the body. You can relieve tight muscles in the left shoulder when you're actually doing acupuncture in the right shoulder. So I think this is an important thing to consider for everyone to, go back to the textbooks and have a look at these reflex arcs. This is some seriously impressive technology that the body has. Although the mechanisms are pretty, you could look at them and say they're basic in that, well, they just respond. It's like a call and response thing. This is impressive stuff. This is what has probably gotten us out, and still does, of a lot of danger. It stops our hand from burning. It stops us from putting all of our pressure on a tack or a nail or something like that. And it's those survival mechanisms that are then laying the foundations for some very complex mechanisms later on when you start applying things like acupuncture or electrostimulation, massage, any kind of hands-on treatment is making use of these nerve pathways and mechanisms that the body has. Now we'll be looking at De Qi, the sensation which defines the acupuncture experience. So, how is the De Qi feeling explained? For acupuncturists, we know it pretty well. It's one of the first things that we really have to get used to when we start needling, because quite often, more often than not, we are asked to needle ourselves before anybody else, so we actually know what's going on. The De Qi feeling is described as aching, soreness, and pressure being the most common, followed by tingling, numbness, dull pain, heaviness, warmth, fullness, and coolness. Historical and contemporary sources agree that obtaining De Qi is necessary for gaining the best therapeutic effects from a treatment. So there are all different ways to apply acupuncture. There is the even method where you just put the needle in and don't get a response. There's sedating, which is stimulating the needle a great deal to get a really big De Qi response. There's tonifying, which is doing it less so, and it's just getting the sensation just enough so they feel it, but then not going any further. There's Japanese acupuncture where you put the needles just on top of the skin, so very superficially, just to it's much more of a gentle approach. So there's all these different ways of obtaining the sensation of De Qi. What they know now in clinical trials is that it's kind of essential for getting an effective response with acupuncture. So it's the way of activating the points, essentially. DIRCHI involves a multitude of nerve fiber types, from fast-conducting myelinated fibers with higher thresholds to slow-conducting unmyelinated fibers with lower thresholds. Experiments have shown that slower-conducting C fibers are involved in the dull sensation experienced in the DIRCHI sensation, while numbness and tingling may involve A beta fibers. So remember, we've got the non-myelinated fibers, which are responsible for continuous conduction, and the myelinated fibers, which are responsible for saltatory conduction. This delivers slow, diffuse sensations, and then this delivers the sharp, fast sensations, fast signals. So we have A delta nociceptors, which are connected to the spinal dorsal horns of the spinal cord via medium diameter myelinated A delta fibers. These have a conduction velocity of 12 to 30 meters per second, about 43 to 108 kilometers an hour. Then C polymodal nociceptors are connected to the spinal dorsal horns of the spinal cord via small diameter unmyelinated C fibers. These have a conduction velocity of 0.5 to 2 meters per second, about 1.8 to 7.2 kilometers per hour. So a great deal slower. Then from Corradino, we have a list of the different fibers and the sensations that they are responsible for. The multitude of different nerve fibers within the skin and the deeper layers of the tissues will create all of these different sensations that we are experiencing every day with all different stimuli from our environment. And this is the patient's perspective. This is what they're experiencing when they have a needle inserted into a point, and then we stimulate it as the practitioner to get this DIRCHI sensation, this heaviness, this dullness, this spreading sensation to let us know that the point has been activated. Now we look at the practitioner's perspective. If you've had some experience doing acupuncture or dry needling or any kind of application of a filiform needle to the body, you will probably have experienced this sensation after having the needle in the skin or in the tissue, and either however you stimulate it, by twisting or lifting and thrusting, it will feel like the needle starts to get sticky and it's actually something's grabbing onto it. So in clinical practice with acupuncture, that is what is recognized as the DIRCHI sensation from the practitioner's perspective. So patient's perspective, the dull, heavy sensation; practitioner's perspective, the needle grabbing sensation, the stickiness. This is happening because nerve fibers become wrapped around the needle and create the needle grasp effect. Unidirectional needle rotation causes winding and gathering of collagen around the needle, pulling collagen towards the needle and inducing an active cellular response in connective tissue fibroblasts up to several centimeters away from where the point is actually inserted. So another example of the importance of the nervous tissue in the application of acupuncture: intramuscular injection of anesthetic prior to acupuncture actually inhibits the DIRCHI sensation as well as analgesia. So once again, if the nerves are not working, you don't get the chi sensation. While superficial cutaneous nerves may be partly involved in the DIRCHI sensation, it appears that penetration of the muscle layer coincides with eliciting DIRCHI. So once again, going back to the importance of what we were saying before about the depth of the actual needle and its relevance to how effective the acupuncture treatment is. Once again, deep tissue stimulation, not cutaneous sensory nerves, attenuated nerve response. And here's a picture of a couple of my patients very generously giving their bodies in the name of acupuncture education. If you can see the pink blushing of the skin around the needle, this is, from the practitioner's perspective, this is one of the ways that we identify that the point is being activated. That the flushing, the blood coming to the surface, is an indication that the DIRCHI response has been elicited. It's essentially one of the signs of inflammation, and it's vasodilation with histamine and all of the other chemical cascade that's happening under the surface of the skin in response to the needle. So to summarize DIRCHI, it's a sensation generated by the stimulation of nerves. It requires the presence of nerves to occur. It involves winding of nervous and connective tissue, and the sensation is related to needle depth in muscle tissue. If you're not adverse to going to purchase a piece of chicken from the supermarket, I highly recommend doing this experiment at home. Unfortunately, you can't do it with a piece of fruit because it doesn't really have the same response. So what I'm about to show you now is the use of a chicken breast, where I actually insert the needle into it. And you can see as the needle goes into the chicken breast, I'm now going to wind the needle up, much like I would during the application to a human body. And you can see that as I lift the needle, the tissue is actually sticking to it. It's actually gripping to it. So on a microscopic view of a needle, we would actually see barbs and little projections coming off it. It's not entirely smooth, of course. Any smooth surface is indeed actually quite rough and textured when you get down to that microscopic level. So it's these textures on the needle, the barbs on the needle, which are actually picking up on the microfilaments of the fascia and the nervous tissue to create the needle grab sensation. And then it's the free endings of the nerve fibers within that tissue that then creates the dirty sensation. So how is it possible to make qi run up and down a channel, sometimes opposite to the direction of the nerve? So remember that nerves only go in one direction depending on what kind of nerve they are. So if it's a sensory nerve, the signal is only going from the periphery to the central nervous system. If it's a motor nerve, the signal is only going from the central nervous system to the periphery. They are not supposed to go the other way. According to this concept, that you're able to make the qi run either up or down a channel, it gives the basis for there being the flow of a yin and yang system within the body that is beyond the explanation of the nerves. So one of the ways of explaining this is something called orthodromic and antidromic propagation. So the stimulation of nerves, including both sensory and motor nerves, can occur both orthodromically and antidromically. Orthodromic, meaning traveling in the normal direction of a nerve fiber, and antidromic, traveling in the opposite direction of a nerve fiber. Now, one of the things that can happen in an acupuncture treatment is when we stimulate one of the points called pericardium 6, which is about here, you can get a sensation that runs down the middle finger, quite like a lightning strike. And it can also happen on the kidney channel, which runs down behind the medial malleolus between medial malleolus and the Achilles tendon. If you stick a needle in there in just the right spot, then you'll basically get it too close to the nerve and you'll get an electric shock run up or down your leg, or in this case down into the middle finger. Now, if you know your peripheral nerves, you'll know that the nerve that runs down here is the median nerve, and the median nerve innervates the palmar surface of the thumb, the first two fingers, and the half of the ring finger. Quite often, though, the signal will go down this finger, but I've felt it in here, and I've heard other patients saying that it can go into the hand as well. Now, according to the direction of nerves, this shouldn't be able to happen because sensory nerve sensation only goes to the central nervous system, right? It's not supposed to be able to go the other way, but it's a thing, it happens. I'm not likely to believe that it's because of a yin-yang flow in the body that it's happening, that it's because of the acupuncture meridian or the channel that is giving the basis for this to be able to happen. I would more likely say that there's a mechanism that is being interfered with that causes the signal to go down the middle finger, whereas otherwise the signal should be going back up to the center. So median nerve conduction studies is a technique used to confirm the presence of carpal tunnel syndrome. The antidromic technique is where a stimulating electrode is placed on the wrist to stimulate the median nerve, and the response is recorded over the palmar digital nerves of the index or middle fingers. The orthodromic technique is where stimulating electrodes are placed on the proximal and middle phalanxes of the index or middle finger, and the response is recorded from the median nerve 1 to 2 centimeters proximal to the wrist crease. Now, I understand they're using electrical stimulation here to elicit these antidromic and orthodromic responses. However, it once again lays the basis for the potential that the nerves can run in opposing directions as to what they are expected to. I'll also come back to this a little bit later on when we talk about referral patterns. Now, on to acupuncture analgesia and how does it happen? So as for local effects, according to Michael Corradino, the needle stimulates vasodilation in the local area and the release of neuropeptides, including but not limited to prostaglandins, red and white blood cells, glutamate, substance P, and serotonin. This chemical soup downregulates the pain cascade and reduces inflammation, heals surrounding tissue, promotes local circulation, and fights infection. At the tissue level, this movement causes winding of the subcutaneous connective tissue around the head of the needle while leaving the superficial skin in place. Stimulation in turn causes the cells within the connected tissue to undergo remodeling processes, as well as biochemical cascades that stimulate the cellular environment on many different levels. So just to go through the list quickly of the neurochemical pathways, among other neurochemicals, acupuncture has been found to stimulate the release of endocannabinoids within the central nervous system, which play an important neuromodulatory role in the control of pain transmission and inflammation. Beta endorphins, which have been found to be between 18 to 33 times more potent than morphine. Dynorphins, which are 200 times more potent than morphine and 50 times more powerful than beta endorphins. There's also oxytocin, which may influence endocrine function, exert both anxiolytic and sedative effects, alleviate pain, and decrease sympathetic nerve activity via stimulation of vagal parasympathetic nerve activity. So that's probably one neurotransmitter that acupuncture is well known to stimulate the release of, which is oxytocin. It's one of the reasons why we are advised against using what are known as the contraindicated points in pregnancy, which are a list of some points that are used in many acupuncture treatments. One of them's gallbladder 21, the other one is large intestine 4, just to name a couple of them. But essentially you don't use them while the woman is pregnant because of the rationale that it will stimulate an excessive amount of oxytocin, which will then bind to the receptors on the uterus, causing uterine contractions and then cause a miscarriage. That's a topic for a whole other course, which I will go into, and I will leave that for now. But without talking about pregnancy, oxytocin is released in considerable amounts from acupuncture, and part of the reason, I believe, is why when you get up off the table from having acupuncture, you feel pretty good and you feel pretty spaced out. You can feel, feel a bit dopey. It's quite an interesting sensation to have. And I mean, oxytocin, one of the many other things that's being released, beta endorphins, dynorphins, serotonin. The serotonin balances excessive excitatory neurotransmitter activity in the brain, and a stable mood depends on there being adequate amounts available. It's also involved in the endocannabinoid pathway of analgesia. And then if we bring electroacupuncture into it, which is where we use a TENS machine and attach it to the needles to stimulate the points, below 100 Hz has been found to stimulate the release of beta endorphins and enkephalins, while over 100 Hz stimulates the release of dynorphins. 2 Hz releases serotonin. And anandamide, one of the endocannabinoids, is significantly increased at 2 Hz and plus 1 milliamp, which activates the CB2 receptors and attenuates inflammation in inflammatory peripheral tissues. It also reduces acute inflammatory pain by activating CB1 receptors. Now on the home stretch, we'll be talking about referral patterns. So this is providing a possible solution for some of those mysteries we were talking about before, where sensations can go in all different directions and where they would otherwise provide a possible basis for there being the existence of the acupuncture channels. There is also the possibility that it's merely just the body's miraculous physiology doing what it does best, which is let us know, the individual that occupies the body, that something is going on. So how can sensations occur in the body that present as channel pathways which are different to nerve pathways? So talking about referred pain, it's described as pain felt at a site remote from the site of origin or stimulation. Patients with various internal diseases can often experience referred pain at structures, usually on the skin, located some distance away from the affected organ. It's thought that this is due to multiple structures, such as organs and muscle tissue, all originating from within the same embryological dermomyotome. So, for example, the pain from a myocardial infarction can be experienced in the left jaw, arm, or hand, going back to what the TCM book was describing before as blood stasis in the heart being felt in the heart channel. In patients with temporomandibular joint disorder, referral pain can manifest in the teeth and other parts of the face. Consequently, referred pain has been mistaken for toothaches and resulted in tooth extractions. Now going back to our channel comparisons again, pain, aching, tingling sensations in the lumbar region or legs may arise from back sprain or traumatic injury to the back. So they're essentially talking about a herniated disc here, causing referral patterns down the pathway of the sciatic nerve. And stasis of heart blood gives rise to pain along the heart channel in the arm or throat. So once again, talking about the myocardial infarction. Radiating pain caused by trigger points or pressing on certain structures may have led early practitioners to conceive the idea of the channels. Pain radiating down a neural pathway from an injury may have been interpreted as a blockage of qi, with a resulting referral pain revealing the channel. So that's what I was talking about in the last part, where perhaps practitioners in the early days were pressing on different pressure points or finding that the areas of pain, and they're causing these referral sensations. And because they're repeatable and dependable every time, you pretty much, you press on, say the radial nerve that comes down the forearm, you press on that in every person and every time in the same place, it's going to create a referral sensation down the forearm. So they then, with enough people experiencing the same thing, they start saying, well, maybe there's something going on here. Perhaps this is one of these channels that everybody's talking about. We now know today that there are things called dermatomes, which is an area of skin innervated by a single nerve. And everyone's seen a version of this kind of depiction here. We've got the face, which is innervated by the trigeminal nerve. Then we've got the cervical spine innervating the skin around the neck, the back of the head, and then the brachial plexus from within the cervical spine innervating the arms. Then we've got the thoracic spine innervating the trunk down into the lumbar spine, and then the sacral plexus down here. So essentially the sciatic nerve coming down here. These are the dermatomes for what would be the lumbar plexus and the femoral nerve. But of course, pain also refers with organs as well. So if you're familiar with the channels in traditional Chinese medicine or channel theory, you might recognize some similarities here of the known referral patterns from organs and the traditional acupuncture channels. So we've got the referral from the heart, generally with a myocardial infarction or a heart attack, and then people will feel that traveling down the left side of their arm. Now, that is, coincidentally or not, pretty much exactly where the heart channel runs in traditional Chinese medicine. On the right side of someone's body, we've got referral patterns for liver and gallbladder. If you find a picture of the gallbladder channel, it runs pretty much similar, traverses the body, but similar to this this pattern here. And then of course the liver channel comes up the leg and actually finishes where the liver actually is. Then the area where we've got the referral pattern for the kidney and the bladder, it's not surprising that the traditional Chinese medicine puts the actual acupuncture point main front point for the urinary bladder is actually, not surprisingly, over the bladder itself, but the sacrum is a center for a lot of bladder points, which help to regulate the function of the bladder as well. Not surprisingly, it's also where the nerves innervate from the sacral plexus to this region. So to go over the characteristics of muscle-referred pain, it tends to follow the path of myotomes, which are muscle innervations. So there's dermatomes, which is areas of the skin which are innervated by spinal nerve roots, and then we've got myotomes, which are the actual muscles innervated by spinal nerve roots. Fascia pathways and sclerotomes, which are innervations of the bones, rather than the classical dermatomes. Muscle-referred pain follows a distinct and repeatable pattern or map of pain. Experimentally induced muscle referral pain presents as diffuse aching pain, pain that refers to distant structures from the initial structure and causes modifications in superficial and deep tissue sensibility in the painful areas. It differs from cutaneous pain, which usually presents as localized sharp and burning. The introduction of anesthetic to the painful area can have no effect on the pain because it is not where it is originating from. For example, the numbing a tooth when the pain is referred from the jaw. It is a defining symptom of a trigger point, and pain will vary accordingly to a range of different factors. So for example, the location and degree of the trigger point irritation, aging and chronicity of the trigger point. So we can see how this complex mapping system can start to give us all of these different signals that we, may not know where they're actually originating from. The trigger point is essentially when muscle fibers become bunched up either from excessive tension or overuse or weakness in the muscle, and this forms a bunching of the muscle, which then presses on the surrounding structure, which then creates this referral sensation. So one of the reasons they believe this happens is nociceptive dorsal horn and brainstem neurons receive convergent inputs from various tissues. Therefore, higher centers cannot identify correctly the actual input source. So to put it simply, if we look back to our spinal segment here, we've got a whole bunch of signals that are coming through the afferent dorsal horn, coming through the sensory pathway here, and it's basically jamming the signal, and so therefore the idea is that the brain can't tell the difference as to where it's actually coming from. Personally, I think the body's a little more intelligent than that. Yes, it's a bunch of ones and zeros, on and off switches, but I like to think that it's a little bit more sophisticated than not being able to tell the difference between a bunch of signals. If it's due to a lack of the brain's capability of differentiating between signals, then why is it always in the exact same spot? Why are referral patterns so repeatable and they're always in the same place? Like, you can almost guarantee that if you've got a referral pattern in a particular area, it's always going to be a particular muscle. Muscles in the neck, the sternocleidomastoids or the scalenes or the levator scapula will always create the same type of headache. You'll always get the same type of referral pattern coming around the front from muscles that are tight in the back. So I like to think that it's a little more complex than just the body not being able to figure out its own warning systems and its own alert systems. Because on one hand, you've got this really complex mapping system, but then the explanation that we have for it is that we can't understand what that mapping system is doing. So it's a bit counterintuitive, and as I said, I like to think the body's a bit smarter than that. So this gives another explanation for mapping of the channels, as well as how we can feel sensations traveling down the pathway of the channel when stimulated by manual acupuncture. So this might also help to create an explanation for the antidromic and orthodromic nerve signals that we were talking about before. So where nerves have the potential to travel in the opposite direction to what the motor or sensory nerve should be traveling in. So if the concept is that the brain can't differentiate between we can't differentiate when there are too many signals in the input, perhaps then the brain is unable to tell the direction of which way a signal is traveling, and we receive it as the signal is traveling in the opposite direction as what the nerve ought to be traveling. That's one possible explanation, but as I said, I'm not a huge fan of this stupid brain not being able to figure out the intelligence of its own body. So what if there's a more sophisticated explanation for that, and that is, what if we're getting those signals, when we're putting the needle in pericardium 6 and we're getting the firing sensation down the hand? What if it's not because the brain can't figure it out? What if it's actually extremely intelligent and it's letting us know that there's a blockage here from this point downwards? So nerves are peripheral, right? If you've got a problem with a nerve this far up, it's going to cause paralysis down from that point onward. So what if that's what the warning system is? What if that is what referral pain really is? It's telling us there's a blockage, there's something wrong in a particular area here, telling us that from that point on, this is where the issue is, and if you don't fix this, then you'll have an issue from down the chain or down the channel, down the river, if you will. So we can see how that concept, if that's the way it works, and this gives some credence to the logic of how a channel works, even though that mechanism is still underpinned by a central and peripheral nervous system. So that is it for part 2, Mastering the Mysteries. I hope that has been a highly informative course for you. Certainly a lot of information in there to take in, I know that. So feel free to go back and rewind and revisit some of the parts that may have been a little bit complex. I just tried to fit as much as I could into that section to really get hammer the point home about the importance of the nervous system in the mechanisms and the application of acupuncture. So in the next section, number 3 and final part, where I'll be talking about a conclusion, a new perspective on Qi and on the channels, where we'll be taking everything that we've learned so far from parts 1 and 2, synthesizing it and leaving you with some new possibilities, new ideas, and ultimately a whole new perspective on the practice of acupuncture and the concept of Qi in the clinical application of acupuncture. So once again, if you're interested in getting your formal point for this course, to obtain your certificate, make sure you follow the link below, complete your course quiz, send us your details, and we will be in contact with your certificate. And finally, make sure you have a look at all of the other courses and content available on OnPoint Pro. So that's the end of part 2. Thank you very much for joining me, listening and watching, and I will see you over in part 3.